A CEO and 4 physicians were charged today in a superseding indictment as part of an investigation into a $200 million healthcare fraud scheme that involved a network of Michigan and Ohio pain clinics, laboratories and other medical providers. The superseding indictment returned yesterday charges an additional wire fraud, conspiracy, adds an additional count of money laundering, and contains new allegations regarding the distribution of over 4.2 million medically unnecessary dosage units of controlled substances and the administration of medically unnecessary injections that resulted in patient harm. Attorney General Jeff Sessions, Acting Assistant Attorney General John P. Cronin of the Justice Department's Criminal Division, U.S. Attorney Matthew Schneider of the Eastern District of Michigan, Special Agent in Charge Timothy R. Slater of the FBI's Detroit Division, Special Agent in Charge Lamont Pugh III of the U.S. Department of Health and Human Services Office of Inspector Generals, HHSOIG, Chicago Regional Office and Chief Don Ford of IRS Criminal Investigation, IRSC, made the announcement. Mashia Rashid, 37, of West Bloomfield, Michigan, Spilios Pappas, 61, of Monclova, Ohio, Joseph Petro, 57, of Novi, Michigan, Tariq Omar, 61, of West Bloomfield, Michigan, and Mohammed Zahor, 51, also of Novi, were each charged with 1 count of conspiracy to commit healthcare fraud and wire fraud. Rashid was additionally charged with District Judge Denise Page Hood of the Eastern District of Michigan. Trial has been scheduled to begin on July 31st before Judge Hood. "We are facing the deadliest drug crisis in American history," said Attorney General Sessions. Sadly, some corporate executives and medical professionals continue to exploit vulnerable patients and the American taxpayer for profit, with 1 American dying of a drug overdose every 9 minutes. This superseding indictment reflects the Department of Justice's determination to prosecute those who engage in opioid-related fraud. These cases are extremely important. Since 2017, the department charged more than 150 doctors for opioid-related crimes. Today's indictment reflects our continued dedication to these important cases. I want to thank our FBI, HHSOIG and IRSC agents, DOJ attorneys, and everyone else who helped investigate and prosecute this case. This multi-agency investigation has led to one of the largest healthcare fraud and illegal distribution of prescription drugs indictments this district has ever seen, said U.S. Attorney Schneider. "I commend the hard work and dedication of the healthcare fraud strike force and law enforcement agencies for shutting down this network of individuals whose greed resulted in millions of dosages of opioids to be sold on the streets of our communities and millions of dollars in loss to Medicare. It is a sad day when Medicare conducted a medical review of the injection claims, it determined that 100% of the claims were not eligible for Medicare reimbursement and summarily suspended the medical billing privileges of one of the pain clinics involved in the scheme, in order to conceal the continued billing of these fraudulent claims to Medicare." The superseding a $6.6 million wire transfer on April 13, 2016, and the withdrawal of $500,000 in cash on July 10, 2017. The superseding indictment alleges that Rashid transferred the proceeds derived from the conspiracy to live an extravagant lifestyle and spend millions of dollars on